And nearly 4,800 Filipino children are diagnosed with cancer annually. This is why the World Health Organization steps in to help the country improve its services for children with cancer. And to tell us more about this, we have in the studio Dr. Ana Patricia Alcazabas. She's from the Philippine General Hospital Cancer Institute. We have also Dr. Catherine Lam, who is a co-director of the WHO Collaborating Center for Childhood Cancer. And we have Dr. Carlos Rodriguez Galindo. He's the Executive Vice President of the St. Jude Children Research Hospital. Good morning and welcome to New Day to all the doctors here.
Good morning.
Now, first, let's talk about the World Health Organization's designating the Philippines as actually the first focus country here in the Western Pacific for this program. Why the Philippines? I mean, don't get me wrong, I'm really glad that you chose the Philippines as that, but what is it about the Philippines that was ideal conditions for it to be a focus country?
I think this really is a combination of the wonderful work done on the ground by the clinicians, by civil society, and very importantly with government support. So from the very beginning, the departments of health and the overall governments has shown consistent support for the needs of children with cancer. And they demonstrated this at a global level by supporting the first World Health Assembly side events for children with cancer back in 2015.
Right.
And then 1 year ago at the United Nations, when WHO formally launched this global initiative for childhood cancer, Philippines was a key member state that supported the events and that's made sure to clarify that childhood cancer should be on everyone's radar and is something actionable.
That's definitely good news. And I also know that the Philippines has actually 3 cancer centers that focuses on children. 130 hospitals are there, but only 3, by the way, are focused on treating children with cancer. 2, I believe, is in the Metro Manila area. 1 is in Davao, and the program is to increase this. Am I correct?
Well, the idea is to go beyond that, so that initially, yes, we need to strengthen the existing programs with, creating more capacity, better quality, and more resources, and that extends from workforce, training doctors, nurses, etc., but also acquiring better technology, etc. However, children are diagnosed every day at every minute, so that is important then to develop an initiative that goes beyond those cancer centers, that goes into all the communities to get early diagnosis, early referrals, engaging the community hospitals so that there is proper diagnosis, treatment, and referral. So it's a systems-wide approach that needs to be taken.
Okay. Now, Dr. Ana, you're here, the representative here, here in the Philippines. What do you think are the most common cancers here in the Philippines that affect children?
So we have a little bit of data on that, based on Rizal and Manila, and the #1 cancer is acute lymphoblastic leukemia.
Okay.
Followed by brain tumors, right? And lymphoma also.
Okay, now will this program be addressing some of the more common cancers that are found here in the Philippines?
Yes, definitely. So we will be focusing on the cancers that are common as well as the cancers that are curable. So that will be acute lymphoblastic leukemia. We have a particular kind of a brain tumor, low-grade glioma, 2 kinds of lymphoma, Hodgkin's and Burkitt's, 1 the eye cancer, retinoblastoma, and then the kidney cancer, Wilms tumor.
Okay. Now, Dr. Lam, I believe this program aims to or has a target of having a success rate or cure rate of at least 60%. That's a pretty good number for those who aren't really aware with cancer research or cancer treatment. How are you planning to achieve this?
This is definitely with everyone's engagements, including the media, and it starts with having all families being aware that childhood cancer is curable, and having all providers be supported by government policies with the appropriate financing, and we call it a cure-all approach. So, and it stands for having comprehensive centers of excellence with an adequate workforce, having universal health care at the heart of all that we do, having regimens for treatments that are appropriate and aligned with essential medicines and technologies, having really good essential evaluation and monitoring mechanisms, including cancer registries, like Dr. Tricia was mentioning, and also underlining that with consistent advocacy, with leveraged financing, and with linked governance and policies that would tie everything together.
Oh, that's great. Now, Dr. Carlos, what do you think are some of the biggest challenges that you might face while trying to achieve this goal of a cure rate of 60%?
So I think we addressed some of these earlier in terms of strengthening the entire health systems. One of the major issues that we are noticing, not just in the Philippines but worldwide, is the rate of children that don't even get diagnosed. And that is something that needs to be kind of highlighted. So
Right.
globally, we think that around 40% of children with cancer don't even get diagnosed. They die even before they get diagnosed. This affects Asia, this affects Philippines as well. The percentage of children that don't get even diagnosed here, we don't know, could be 20, 30%. And among those that get diagnosed, we think that around 1/3 of those abandon treatment just because they don't have the resources or they don't have the capacity to attend the treatment. So I think that strengthening at the base, creating the right environment for these children to be diagnosed, to be referred, and to be supported through the treatment right now, to me, is the greatest challenge that we have.
All right, right. Great news, great news. I'm definitely excited for this program, and I thank you, all of you, for joining us, Dr. Carlos Rodriguez, Dr. Patricia Alcazabas, and Dr. Catherine Lam. Thank you for joining us.
Thank you
Thank you
so
so
much.
much.
Thank you.